A Missouri Republican lawmaker has introduced legislation creating a registry of pregnant women deemed at risk of abortion, a proposal its author calls an eHarmony for babies, designed to connect expectant mothers with adoptive parents. This Save MO Babies Act would establish two interconnected registries, one for women considered at risk of having an abortion and another for individuals seeking to adopt. Registry members would have access to each other's information, with Missouri government officials facilitating introductions and adoptions. The stated goal is to reduce the number of preventable abortions in Missouri. Gerard Harms, an adoption attorney and the bill's author, testified before a Missouri State Legislative Committee, explaining that the database aims to connect mothers choosing adoption with prospective adoptive parents. This legislation is the latest in a series of anti-abortion measures aimed at increasing government surveillance of pregnant women and those seeking abortions. The Conservative Policy Playbook, Project 2025, advocates for expanding the Centers for Disease Control and Prevention's (CDC) surveillance to compel states to provide comprehensive abortion data, including the number of abortions, gestational age, reasons for the procedure, mother's residence, method used, and information on miscarriages, stillbirths, and treatments resulting in fetal death, such as chemotherapy. Project 2025 also proposes weakening Joe Biden's administration's interpretation of the Health Insurance Portability and Accountability Act, HIPAA, the U.S. law protecting patient privacy. This interpretation limits circumstances under which healthcare providers can disclose patient information to law enforcement regarding abortions. Senator J.D. Vance, while still in office, signed a letter opposing this guidance, and the Alliance Defending Freedom, a conservative legal group, has filed a lawsuit challenging it. Donald Trump, in a Time interview last year, indicated a willingness to allow states to monitor women's pregnancies to detect abortions, stating, "I think they might do that," adding, "The states are going to say, it's irrelevant whether I'm comfortable or not." He later attempted to retract this statement. Indiana is currently involved in a legal dispute over access to abortion patients' records. The state's Republican governor and an anti-abortion group sought access to records of individuals who recently underwent abortions, permitted only in cases of rape, incest, or medical emergency. A judge recently blocked the release of these records. The future of the Missouri bill remains uncertain. However, Missouri Republican lawmakers have introduced numerous other abortion restrictions, including legislation attempting to overturn a November ballot measure that enshrined abortion rights in the state constitution. Missouri has become a central battleground in the national abortion debate. Following the passage of the November ballot measure, abortion providers filed lawsuits to challenge the state's near-total abortion ban and other restrictive measures. The legal battles surrounding abortion access in Missouri continue to unfold. The introduction of this registry, therefore, represents a significant escalation in the ongoing conflict over reproductive rights and government oversight of women's health care choices. The implications for patient privacy, the potential chilling effect on women seeking health care, and the ethical considerations surrounding the creation of such a database are profound and warrant careful consideration. The eHarmony for babies analogy, while superficially appealing, obscures the deeper concerns about governmental intrusion into deeply personal reproductive choices and the potential for misuse of sensitive personal data. The legislation's ultimate fate will significantly impact Missouri's already contested landscape of reproductive healthcare access, potentially setting a precedent for other states considering similar measures. The debate surrounding this bill highlights the complex interplay between states' rights, individual liberty, and the ongoing national struggle over reproductive rights. The bill's passage, or lack thereof, will be closely watched as a barometer of the shifting political currents impacting abortion access across the United States. The ethical considerations involved, especially concerning the potential for coercion and the compromise of sensitive patient information, should be paramount in any future discussion and legislative action. This highlights the broader national debate surrounding reproductive rights and the role of government regulation in women's healthcare decisions. The long-term effects of such policies on women's health and well-being remain a significant area of concern for advocates and policymakers alike. The implementation of such a system also raises questions regarding data security, potential misuse of personal information, and the overall impact on the trust between patients and healthcare providers. The lack of transparency and potential for coercive measures represent serious ethical concerns that deserve careful scrutiny. The debate continues to evolve, highlighting the deep divisions within society regarding reproductive rights and the boundaries of government intervention in personal medical choices. The long-term implications of this legislation, should it be passed, will have far-reaching effects on the landscape of abortion access and reproductive health care in Missouri and potentially beyond.